Hello and welcome. Today we're diving into a condition that can mimic heart problems but stems from a completely different source, thoracic outlet syndrome, or TOS. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. So, what actually causes thoracic outlet syndrome? TOS occurs when nerves or blood vessels in the space between your collarbone and your first rib, the thoracic outlet, become compressed. This compression can be due to a variety of factors. Anatomical abnormalities, like an extra rib, are a common culprit. Trauma from accidents or repetitive motions can also inflame the area and lead to compression. Poor posture, obesity, and even pregnancy can contribute as well by altering the space within the thoracic outlet. Let's understand the underlying process. Imagine the thoracic outlet as a narrow passageway. When the space within this passageway is reduced, the nerves and blood vessels passing through are squeezed. Nerve compression, often involving the brachial plexus, can result in pain, numbness, and weakness in the arm and hand. Blood vessel compression, which may affect the subclavian artery or vein, can impair blood flow, leading to swelling, discoloration, and even blood clots in some cases. Thoracic outlet syndrome isn't rare, but pinpointing the exact prevalence can be challenging. Many cases are likely undiagnosed or misdiagnosed. It tends to affect women more often than men, typically between the ages of 20 and 50. Athletes involved in overhead activities, like baseball pitchers and swimmers, are also at a higher risk. People with jobs that require repetitive arm movements or prolonged awkward postures are more susceptible as well. The symptoms of TOS can vary widely depending on which nerves or blood vessels are affected. Common symptoms include pain in the neck, shoulder, arm, or hand. Numbness or tingling in the fingers is also frequent. Weakness in the arm or hand can make everyday tasks difficult. In cases of vascular compression, you might notice swelling in the arm or hand, a cold or pale hand, or even discoloration of the fingers. Because these symptoms can resemble other conditions, like carpal tunnel syndrome or heart problems, it's important to seek proper medical evaluation. Diagnosing tests can be tricky, as there's no single definitive test. Doctors rely on a combination of a thorough physical exam, a detailed medical history, and specific diagnostic tests. The physical exam involves assessing your range of motion, checking for tenderness in the thoracic outlet area, and performing provocative maneuvers that attempt to recreate your symptoms. Nerve conduction studies, such as electromyography or EMG, can help evaluate nerve function. Vascular studies, like Doppler ultrasound or angiography, can assess blood flow in the affected vessels. X-rays may be used to rule out bony abnormalities, while MRI or CT scans can provide detailed images of the soft tissues in the thoracic outlet. Thoracic outlet syndrome is generally categorized into three main types based on the structures affected: neurogenic TOS, which involves nerve compression, arterial TOS, which involves compression of the subclavian artery, and venous TOS, which involves compression of the subclavian vein. Neurogenic TOS is the most common type, while arterial and venous TOS are less frequent but can be more serious. The treatment for TOS aims to relieve compression, reduce inflammation, and improve function. Conservative treatment options often include physical therapy to strengthen and stretch the muscles around the thoracic outlet, improving posture and increasing range of motion. Pain relievers, muscle relaxants, and anti-inflammatory medications can help manage pain and inflammation. In some cases, botulinum toxin injections may be used to relax the muscles contributing to compression. If conservative treatments are unsuccessful, surgery may be considered to decompress the thoracic outlet by removing the first rib, releasing muscles, or repairing damaged blood vessels. While it's not always possible to prevent TOS, certain measures can reduce your risk. Maintaining good posture is crucial, especially when sitting at a desk or performing repetitive tasks. Avoiding prolonged overhead activities or awkward arm positions can also help. Strengthening the muscles in your shoulders and upper back can provide better support and stability. If you notice any early symptoms of TOS, seek medical attention promptly to prevent the condition from worsening. The prognosis for TOS varies depending on the severity of the condition and the effectiveness of treatment. Many people with neurogenic TOS experience significant improvement with conservative treatment. Vascular TOS may require more aggressive treatment, and the prognosis depends on the extent of vascular damage. Recent research is exploring new diagnostic techniques and surgical approaches to improve outcomes. One area of interest is minimally invasive surgical techniques, which can reduce recovery time and scarring. Researchers are also investigating the potential role of regenerative medicine in nerve and blood vessel repair. As our understanding of TOS continues to evolve, we can expect to see even more effective treatments in the future.